hi, everyone. Awesome. Getting all set up. Oh, it is so beautiful to see everybody getting the booms adjusted for today's IG Live. I'm so excited. We are going to be having Lindsey on today, which is great. Hello, Lindsey. Let me go ahead and we will have her join. Awesome.
Hey, lady.
Hello. How are you? Oh my gosh, you look so cute.
I was in Baltimore visiting my mom, so I thought I would get a little fancy out of workout clothes.
Oh.
Massive jumpsuit, but I don't know if that's...
I love it. It is adorable. Well, as we have people joining us, I like to do a little bit of intro so people know how we kind of cross paths. So Lindsey and I met each other at a continuing education where she was actually one of the people that was training me to be a better physical therapist. So we met through a company known as PT on Ice. And so it has been so amazing because we've been able to, she's been out another time. I've been able to take more trainings through her, and it's been so fun to watch all of the knowledge that I've learned through your various online platforms, but mainly through this Drive PT. I love all of the amazing videos that you shared, and I especially loved all of the stuff you shared with my Instagram followers. So thank you.
Well, thank you for having me. It's an honor to be a part of it, and I love kind of how we met. Just it was serendipitously, I would say, and just kind of connected at that course and kept in touch ever since. So that's been really special, and to see you grow and go into your own practice. And
yes. So I am very interested to hear, and let me know. I'm looking at my bars, so make sure that you can hear me okay. But I'm interested to know how you got into physical therapy. So I know you have alphabet soup behind your name, but I'm interested, how did you find your way into physical therapy?
that's such a cool question. So I wanted to be a teacher since I was a little girl. And then in high school, I actually fractured my pinky. So it's still a little crooked. So the fifth is for the PT and healthcare professionals with us today. And my mom, was kind of tough, and she just said, tape it up. And I kept playing volleyball, and it still hurt, and I couldn't bend it at all. And she was like, we probably should go to the doctors. And lo and behold, I had PT on my pinky. And so that's when I learned what the profession of PT was. And I realized it was just the perfect profession, because I realized you're teaching your patients every day. I loved the human body, so it incorporated that piece. And I knew I didn't want to be at a desk job. I wanted to always be interacting with humans. So yeah, it just was the perfect profession. And since, I guess, junior year of high school, I knew that's where I was headed onward.
Oh my goodness, that is amazing. So I found out that I wanted to go into physical therapy after I had already gone through college and had been in athletic training. So I think that's pretty incredible, knowing so young in high school, as a junior in high school, let alone that you wanted to go after this career. So that's pretty amazing. And then how did you know, as you were going through your physical therapy training, that you wanted to go after such an active population? So if people are just tuning in, and maybe you didn't catch the takeover that Lindsey did, Lindsey does see a wide range of human beings, but many of her population can be a more active population, tending to be in the CrossFit community and things like that. But you do see a wide range of people. But I'm just interested to know, how did you know maybe that outpatient realm was more the realm that you wanted to focus on?
It's really interesting that, all in school, all my affiliations were outpatient. So I kind of thought that was the route I was going with athletes because I had played college volleyball and I thought that was my calling. And then after going through a bunch of outpatient affiliations, I was like, I don't know if I like this. And so I actually went into rehab, inpatient, acute care, trauma for like the first year and a half. And then it was funny, I had kids back to back and realized like they're not the most family friendly schedules when you're in that. And I was like, I think I need to get back into outpatient. And what I really realized taking a couple continuing education courses through evidence in motion, that when you're practicing excellently, outpatient is really fun and it's cool. And when you're doing it in an evidence-based manner, it's just very rewarding. And at one point I got to a point that I was so jaded with outpatient that I thought it was just watching people exercise. And so I didn't want to do that. I thought I'd make a better impact in the inpatient space. But anyway, once I kind of took that path of getting back into outpatient because of my family, I went full speed ahead and left inpatient completely, besides some per diem here and there, and then went on to get board certified in orthopedics and then my fellowship training through evidence in motion. And, you joked about the alphabet soup. That's just something that comes along the way, but I would say that wasn't my motivation to get those letters after my name, but more, I didn't really feel good enough. I knew I could be better. And so those, they hold me accountable, those letters, to study and get to know orthopedics more thoroughly. And then fellowship really just helped me hone in my clinical reasoning that you don't just have patients doing 10 different exercises. Each exercise has a purpose and you're going to test, retest, and make sure that progress is being made. And if it's not, then you're going to abandon it and change it. And that's what, real physical therapy, true good physical therapy. And I know you can attest to that. And you're one of those excellent PTs, but you're going to make change. You're not just going to keep doing the same thing.
Yeah, and so I think that's a really important thing to highlight about the exercises, because I was going back through what you shared on the takeover, and I was really, really loving it. And I loved specifically one of the slides where you talked about the importance of progression and the importance of regression. And I loved that. And you were talking with the bird dog exercise. And I thought that was so cool. So again, as people are maybe watching this now or watching this later, bird dog is where you're in a hands and knees position. And oftentimes you're reaching the opposite arm and the opposite leg. And it's something I see all the time in yoga. I see it all over the internet all the time to get that core. And I loved how you highlighted that and showed different ways to utilize it, because it is, I see it so many times when I go to the gym pre-COVID, but even when I'm watching videos and people are doing it incorrectly. And so I think it's really neat that you are talking about the importance as a PT being that test and retest, to see if your patient's progressing, and even, talking to the audience to be able to maybe share how they can maybe figure out if they're progressing through that exercise, or maybe they need to take a step back.
And I would say, that I had mentioned on the takeover that I really want people to have freedom of motion, and there's no such thing as perfect movement, but I would say there are movements for each person's individual body that work better. So sometimes the bird dog isn't the thing that's going to help, that midline become engaged. And I use midline because core was so drained into me in PT school, and it's become problematic for a lot of people to say even a lot of healthcare professionals, doctors, yoga instructors just incorporate or say that the core is weak and that's why people have pain. And I would highly disagree with that. It's how people are using their bodies, because if your core is always turned on, then you're constantly loading your spine and it never gets a chance to relax. And then if you're constantly kind of loose, letting your belly hang out and no awareness of like your spine and how it moves, that's also not great. So it's the other extreme. So teaching someone to have awareness of their body, it might be the bird dog position. It might be just getting up and off the floor if it's geriatrics, or it might be a deadlift for a more active population.
Mm-hmm.
So my little guy, even though he's not supposed to be here, is sneaking in.
Oh,
Because my husband's supposed to be on. Little Luke, you want to say hi to my friend, Miss Laura?
hi. We love kiddos. Hi, buddy.
Hi. Can you say hi? How are you?
What a
I love you.
cutie.
The third kid, he just gets away with
Oh, all the things.
all
All the things. So tell me, how did you come to this? Because I loved hearing about this midline position and kind of taking a break from core. So how did you come? Is this something that you just came to this idea of midline, or tell me more about it?
So I think I've even grown probably in the last 6 months to a year, even how I even speak about the bird dog and how you have perfect TA, transverse abdominis activation, and multifidus, because again, I think that vilifies movement and makes it seem like it has to be a certain way to be good. And even my students at South College, I've changed how I talk about the bird dog, even from last year. But I guess I've chosen midline because I think about, and it's that center. So it's not only anterior musculature, but posterior musculature, and then lateral musculature. So our obliques, and we're thinking about anterior muscular, like our rectus, not just those deep stabilizers, and they're all involved in movement. And so I'd rather just say that midline, that middle of your body, and how is it engaging? How is it moving? How's it interacting with your arms and your legs? And is it... Can you still hear me?
Yes, I can.
Sorry about that.
That's okay.
So the beauty of live, right?
Yes.
Organic and raw. But so I kind of have gotten away from saying core or naming muscles, but just thinking about, can you control that middle of your body, or can you relax that middle of your body and let your arm completely? And it is really individual that of what I'll choose to, and what I'll choose to help someone. But I do think in that pelvic floor space, a lot of times, and you know more about this than me, but either sometimes it's too much tone all the time. So those people, I probably want to just teach to relax. And maybe I'm just telling them to reach long within that bird dog position with their right arm and left leg if we're doing that opposite, and not even think about midline. Think about like relaxing your breath. Think about relaxing midline or middle versus the person, the CrossFitter that's super strong, has a lot of growth strength, but their internal transverse abdominis and multifidus, they're not maybe as great at activating or even having awareness. Then I might need to think like, let's get a little bit more control in those deep stabilizers and then reach out. And so just to show the difference in what people might need.
Mm-hmm. And so what's really coming through for me is this idea almost of play, which I think is so, so cool and so important. Because it's this idea of the whole point of physical therapy is to be physical, right? The whole idea is that we're supposed to be mobile and move and not be rigid. And so when we throw around words like anterior, posterior, deep stabilizers, or any of these things, those terms, whether they hit home with you or don't hit home with you, really what we're really getting at is that ability to find something that you connect with, and to be able to find that thing you connect with and to be able to move well from that, which is one of the things that I know you put on one of your slides, is that moving well, which I think is really cool and really important. What I loved about your takeover and showing different movements, whether it was the bird dog, whether it was doing the movement overhead or moving it in front, and then even doing that deadlift, is the importance of moving well. And especially as someone who's a mom, as someone who's dealt with like a geriatric population up to a CrossFit athlete, and many of these movements come from connecting with that, our center. So I just love how you talk about that. And why do you think in the last 6 months or year maybe conversation or interaction has changed? Do you think it's because it's changed for you personally, or maybe you've come across research differently?
I think it's both. So like Greg Lehman is someone that I follow, and he just talks a lot about, like you said, play and experimentation with movement, and that it doesn't have to be perfect. In some research as well, where there's an extreme case. I don't know if you've ever read Words That Harm, Words That Heal. So not how powerful are our words that influence patients, but also to the degree of, there's a case where a woman, because she was told she had for her whole life, she decided not to have a baby because she didn't think her pelvic floor could maintain that. And like that really sunk and stuck into my head, that like if I'm telling someone they need to turn on their transverse abdominis and multifidus and making them feel like they have to be so conscious of movement, I'm not being a good physical therapist. I'm not being a good human. I'm not encouraging them to move and interact with their world. And so I think it's been a mix of just great PTs I've come into contact with and research, and just realizing that if you have patients move and really monitor how they move, they will get better. And so like that move well, move often is always a hashtag I use on Drive PT, because I think if you do that and you listen to your body, you're going to get better. And I think I'm finding that it doesn't matter as much what that movement is. I do think you need to be strong, and I do think you need to have a good diet and sleep and good nutrition, and that strength increases resiliency. And so that combination of factors, and even thinking about cardiovascular health, like the whole person, I've just come again in the last 3 to 5 years understanding the importance of that and really addressing that with people, because people won't get better, especially CrossFit athletes, if they're not sleeping and they're stressed at their job, and that even getting in 5 days a week of movement at CrossFit isn't necessarily the thing that they need. Maybe they need more rest days. Maybe they need or more protein. And so even if that doesn't mean I can give them all that, I can refer them to people that need it. Or maybe their pelvic floor is not doing great, and I can refer them to a pelvic floor specialist.
Right.
But more is not always better. And so
Right.
my coaching, and I say coaching because I do think that's what we do as PTs. We coach movement to make it better. I've learned that less is more.
Right. And so I have had a slew of individuals, patients, as well as individuals on Instagram who I feel like are knocking at the door of change. They maybe have had this realization of, I don't think my diet and exercise, maybe my sleeping habits, they're not serving me, but they're kind of having trouble walking through that door and kind of making time for those changes. Because they maybe look at their day and they're like, I have to do the gardening. I have to go deal with the aging parents. I have to go do business stuff or do this or do this. What maybe pearls do you give patients who they've shown up to you? So they say, I want to change. And you do really feel they want to change, but they're having trouble kind of stepping through or stepping into that change. What maybe pearls do you have to give people to kind of invite that change or start to shift?
I think small changes done consistently are one of the most effective things. So if it's someone that is getting 6 hours or less of sleep a night, and I'm going to ask them to prioritize that and see how their body changes, that they get that 7 days a week, that they're shooting for 7 hours or more. And I know that's hard for people to adjust, but I would ask them to do that one thing versus saying, okay, you need to make sure your hydration is perfect. You need to make sure you're meal prepping, and you need to. That's really unrealistic. So, and maybe it's even 3 nights a week to start, and
Right.
check that off the first week. And then maybe if once that's successful, then you do 4. And so it's building, and each person's really, people are ready and they're going to go gung ho.
Right.
I try to encourage little steps. And then for those, like if we're thinking about a busy parent, and I specifically didn't say busy mom, even though I wanted to, because I'm trying to work on my gender neutral.
Yes.
And It's more challenging than you think. And if guys yell at me, okay,
Mm-hmm.
or guys at any point during this,
Right.
hold me accountable to be better. I digress. I use what is called the Rehab EMOM, which ICE, the Institute of Clinical Excellence, that I work for post-professionally as lead faculty for extremity management, really helped me learn about the importance of, so EMOM is just a type of exercise structure where you, every minute on the minute, you do some activity. And what that allows is high intensity, but at the next minute, you have to start whatever that next activity is. And what I've found using the Rehab EMOM incorporates some mobility stretch exercises and then a hot 1 minute of like high intensity cardio. Or it could be three things that are rehab specific and then a minute of rest. It's doable for that person. So maybe it's a EMOM and every minute on the minute you track that out for them. And so it's easy to get that movement snack in. So it doesn't feel that overwhelming either. So it's not that they are able to do an hour of PT once a week or a couple times a week, then that we figure out ways they can incorporate movement throughout their day that is doable for them. And I also like to just, if it's, you know, a specific pain we're dealing with, whatever that 1 to 2 things that help them feel better, teach them how to incorporate it into their day very easily. So it's not a, I have to stop everything I'm doing to do this. But if, say, it's neck pain, like I'm sitting here talking to you, maybe I want to do some chin tucks every hour. An alarm on my phone, Apple watches do that anyway. Breathe and do some chin tucks, making it accessible and easy for them to be successful.
So I love that. Small changes and then accessible and easy. I think those are the things that are so huge. And I love to hear them reiterated. One, because it means that I'm saying the right thing to patients. But two, I think that that's really important because so many times I think people look at it and they might see you online, and I love watching you online, and I love seeing how you like work out, and you'll be like, oh, my husband snapped a picture of me working out, and you've got like, you're like deadlifting in your, you know, front yard, it looks like, and stuff. And I'm like, oh, that's so awesome. And you see this whole picture of this person, but I know, because I know you outside of it, I'm like, oh, okay, she's doing these like little things throughout the day. She's doing a video here. She's studying to get her alphabet soup behind her name here. She's got her kiddos in there. You know, she's got date night here. And so I think it's cool because I know you practice what you preach, but then also I can see those things that you're saying, how they're implemented for your patients and how they're implemented even for yourself, of do these small changes, do these little things to then capture this whole person and make them better and healthier, which is really, really neat.
Thank you. That means,
Yeah.
I think if you aren't, as a PT, if you aren't moving and something, it doesn't have to be functional fitness or CrossFit. It can be whatever, you know, sets your soul on fire, but be moving. And so that's something that helps with my overall health. And I think every PT should be that example. And I do, social piece is really key. And that's why I have my cocktail here, because you also need
Yes.
and enjoyment. And I
Yes.
also have a cocktail. So I just was like, let me have this.
Yes. That's awesome.
By the way, I see, and my students, like, it's pretty cool, are tuning in. Hi, guys.
Yes. Hello, people. I love it. Yes. And this is going to,
Messed up my gender neutral language just then. Hello, humans.
hello, humans. Yes, it is very, thank you. I appreciate that. We have Laura Meihofer and Clitoris Collective have a pretty big following with LGBTQ folks, which is amazing. So we appreciate the gender neutral terms. And I think the biggest thing that we learned from an IG live that I did a few weeks ago with Vanessa was just the willingness to do better and be different. That's the biggest piece of it. So just you saying, I'm acknowledging that I'm trying to be better and I'm gonna do it, that's what is awesome, and we love to hear. So I am interested to know, so I found this fascinating. First of all, I'm obsessed when I like I'm doing a happy hour and I'm having someone do a takeover, I love looking at people's like their ats. So it's like at Drive PT, which just says so much about you because it's like at Drive PT, like yes, that tells me something about you. And then the other one, which I don't, is it Fit? No, wait, Bear.
At Bear Fitness. So that's the home of Drive PT.
Yes. And then, so, okay. So I always think of like a mama bear when I hear like the bear fitness. And I'm always like, yes, like you remind me of like mama bear. You got your little kiddos around. They're so adorable. They're so cute. And so, yeah. And so it was fun tagging you. And I just wanted to know, like, did you help start Bear Fitness? Is it Mama Bear? Did I just create that in my head?
You might get a little story that I like it. So my journey, because I actually realized I never answered your first question about how did I get to the active CrossFit population, but I
Yes.
all to Mama Bear Quinn, who is the originally started CrossFit Bear and has since changed to Bear Fitness just because of some um, political things that happened with this previous CEO of CrossFit kind
Mm-hmm.
of being a little racist. And so some gyms broke away from that,
Mm.
uh, including CrossFit Bear. So we're Bear Fitness now. And they really, Quinn is my coach and my friend and really just helps spur on my love of CrossFit and functional fitness. I did every workout probably under the sun, Taebo, buns of steel,
Yes.
yoga, Pilates, um, anything you can think of, I tried. And it just, besides volleyball, it never really stuck as something that I loved or stuck with consistently. And then I found CrossFit and it just kind of changed my world around. And I was working in a busy outpatient clinic and kind of sick of seeing 24 patients or more. And so I decided, after forming a lot of relationships after a few years at Bear Fitness, Quinn opened up a space for me. There was room, and I just said, "Yeah, I'm going to go for it." And then that's kind of how my journey to working with functional fitness or CrossFit athletes. And so I'll say I didn't get into PT to do that, but I love it, and it's a sport that I'm addicted to. I used to call myself CrossFit skeptic turned addict because it used to get this really bad rap when you were when it first came out, because of course PT saw the injured people, so they had this very bad poor mentality that
Yes.
just hurts people. And it really, I would rather have very fit individuals that maybe have shoulder impingement or mechanical shoulder pain, but their heart is healthy, their cholesterol is low, their BMI is low, and deal with those mechanical injuries than to have the opposite, someone that's not fit, someone that's not active. And so the mama bear thing, I am a mama bear to my little my kids, my 10-year-old Daniel, Jacqueline, she's 9, we call her Jack, and then Luke, who you guys saw pop in, he's my fairy-year-old, my wild child that keeps us laughing and
Yes.
driving the same thing. But I'd say every mom or parent probably gets a little mama bearish or protective if there's threat, if there's a sense of
Mm-hmm.
harm to little ones. It even happens to me on the playground if I see like a little one being mean to. But anyway, but I think so. Bear Fitness is just, it's my home and where I like to work out, and Drive PT's home.
That's very cool. That's really, really cool. And how long have you had your own practice?
So we're going over a little over 2 years now.
Wow, congratulations to another fellow woman-owned business. Woo!
All the energy,
Yes,
amazing.
yes. And how has it been going just through all of the craziness with COVID? And like you said, you're out in Delaware, and just with everything that's going on with all of the Black Lives Matter and everything, I like to make sure with everyone that's coming on, are they safe? Are you doing okay?
I, I feel safe. I do feel that, we're at a time that's just, we're working through a lot as a nation. And I'm spending a lot of time just to learn how to be an ally and learning about the biases and the white privilege that I really took for granted. And so learning how I can be better as a human, and how as a PT I can reduce socioeconomic disparities. I feel like that's the space I'm in right now, constantly kind of evaluating self and seeking knowledge to be better, and somehow reach out to the community. And um, that's, I think it's just hard. And coronavirus, definitely from a business perspective, it took a little dip where like there was a month of really nothing. Partly that was my decision for safety. There was a spike specifically in Delaware when we kind of hit our zenith. Once it started coming back down and leveling out, I started again, and things have picked up. Drive PT is an intentionally part-time practice, because I'm also a professor at South College. I'm a DSC student at Bellin College, and then the three kiddos keep me on my toes. So right now it's just kind of the perfect balance.
Nice. Very, very good. And how frequently, saying that you as a PT, you think it's important that we get moving, how frequently do you find that you get to the gym or you get to work on mobility and do that sort of thing?
So 4 to 5 days a week. We're getting to the gym. This week, last 2 weeks have been a little crazy, so it's been more like 3 to 4. But I would say my regular goal is 5 days a week. But if I don't, make that, I don't beat myself up about it, because I've also learned over the years that the days that feel really stressful and you haven't slept well, it's really not worth. That's when you're at risk for injury. When you're at that low stressful point and you haven't slept, you're not hydrated well, and I've seen it happen in myself and then in my fellow people that I work out with and in my patients. And so those are the days that I just don't sweat being there, or that not being there. Or I'll do something little at home, like a 10-minute yoga. I do have a yoga app on my phone, and it's really literally called Quick Fix Yoga. And and I love doing that and combining it with breath work. And then whatever my individual body needs. I've also done a little less the last 2 weeks because I have like a little meniscal sprain or possibly tear, hopefully not, but I'm rehabbing it, myself, but taking a little time just because it's swollen.
Yes, yes. Yeah, I think that it's always interesting to again see, like, as our lives sort of ebb and flow. I mean, we just came off of 4th of July, and I can't tell you how many clients came back to me and they're like, "Oh man, I was so bad at my exercises last week." And they're like, "I just can't figure out why." And I'm like, "What do you think you were doing last week?" And they're like, "Well, I mean," and I'm like, "It's grill outs, it's barbecues, it's late nights, it's families, it's friends, it's all of that stuff." And since we can't do it in our typical day, it seems like a lot of people sort of spread it out. So they still got in all of the people they would have seen, but it was maybe spread out over an entire week instead of the one like weekend or whatever. So again, I love hearing these things kind of reiterated about kind of that respecting your body, but still trying to work for that maybe 5 days a week or whatever you think is good for your body, but then still respecting that ebb and flow. Now, I am always interested as a fellow professional, as someone who is a highly driven person, interviewing another highly driven person. And I find that a lot of individuals who follow me on Laura Meihofer, also highly driven people. And I find that content that I talk about, or things that I post where I share about balancing relationship and job and exercising and all of that, people seem to engage a lot in. So I'm interested with you, and I know we've talked a little bit about this candidly. How do you balance your relationship, your job, all of your working out, all of that with your hubby, with your partner? Because I think it's so beautiful. Again, I've had the beauty of kind of Insta stalking you for a while. And so I would love to hear the actual side of it, and hear how you just have that flow.
Thank you. That's such a great question. And I think over the years, I've learned that there is no perfect balance, and trying to pretend that that's attainable isn't healthy. And so,
Mm-hmm.
understand that it's okay that sometimes, like some days, the balance is going to be more spent on my business and
Mm-hmm.
less on family. And some days it's going to be all family and really no business and no schoolwork. And I'm going to set those boundaries at certain times where it's off limits. And like, for instance, like doing this tonight, I usually don't have night hours, but this is something that's important to me, and my family knows and understands that. And so having that conversation with them, like I have this going on this week, like Adam and I, my hubby, we always have like a weekly meeting where we talk about our schedule. So we have expectations for each other and what that means and how we can serve one another in that way, and also give each other space um, to do what we need to do to be our own individuals. So, and I will say, coronavirus has been tough in that we are a little stir crazy, all being home together. And I think that changes the dynamic of the relationship, but we also are really open about talking about it. Like at the end of the night, we're just tired. So spending time intentionally to enjoy one another, it really does take work because I just want to go to sleep. There is a out, my cup is really full right now because I am in school and I am teaching and I am trying to run a business and be a good parent, good wife. The house is suffering,
Mm-hmm.
but understanding that I won't be able to dust at this period of my life, and gracious to myself that that's okay. And I definitely have meltdowns, and Adam kind of encourages me along the ways, and we'll also take some time to just sip on some tequila and do some yoga or do some.
Yes.
I do one thing I didn't put on the takeover that I meant to, but just what's important to me is being still each day. And I find if I can even just have 5 minutes mindfulness, being still and praying and reading my Bible, like that's just how I keep centered. I know I have a much better and productive day if I make that a priority. And
Mm-hmm.
I know I need for my balance, but it is a lot of give and take. And the one thing is a great book. I forget the author at the moment that helped me appreciate that you think that you can be perfectly balanced, but it's okay that you're not. And
Mm-hmm.
there's going to be shifting of the balance.
I love that. I love that. And doesn't that so play into the midline thing that we started out with of like how you shared how it's not all about this core stability and making sure these set standard muscles are tight, like our transverse abdominis, our rectus, our multifidus, which again, if you are not a person who knows all of the anatomy, basically it's your entire abdominal canister. It's not about having this rigid abdominal canister. It's about being able to move and flow within that stability and flexibility. And I always say it's like it's on a dimmer switch and have a really bright, tight, active core, but then be able to have more of a dim, like not as bright, not as active, and to be able to move in and out. And that's kind of what you're saying life is, and I just think that's really important to highlight, whether we're talking about clients, whether we're talking about, like I told you, my mission is health through knowledge and movement, is that one of the things I want to always convey is that it's, there's lots of, my dad always said, there's more than one way to skin a cat, Laura. And so there's lots of different ways to get to this end thing. And I think it's so important to highlight that.
That's really beautiful. I love.
Yeah. And I think it's really interesting how, well, of course, I'm a anatomy nerd, physical therapy nerd. And I love how, like you said, finding that stillness throughout your day. And you were saying how some of your students have been tuning in and tuning out. And maybe I know we'll be able to have this replay. I'll be able to send it to you for YouTube. Maybe you'll shoot it out to your students. But I think that's one of the biggest things. So I just turned 35 on June 15th. Thank you. And it was one of those epiphanies that I've had in the last few weeks about kind of taking kind of just taking stock of what's important. And I thought I kind of always knew what's important, but again, it's finding that time for stillness, finding that time for activity, finding that time for engagement, finding that time for working out. And sometimes I think we just get moving so much, it all blends together. So I love that you highlighted that.
Thank you. And I've had to learn it the hard way a little bit. You know, those days that feel super chaotic and you're just constantly moving, your fight or flight system is just on the go. And we talked about practice what you preach. So if I'm going to tell my patients, like, they need to dampen down their sympathetic system with some breathing, like, I better be doing that same thing to be that good example and just to be better for them, because your brain can't function as well or make great decisions as a PT if you are always in that go, 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 go. So,
right. Totally. So, I have to laugh when you're saying about that. So for so many things, I have like done my own exercise routines because I've had patients come back and be like, there's no way, this exercise is so hard. Blah, 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 blah. And it's funny how my exercise routines when I first started out as a PT in 2012 versus now,
so different, right?
Like 10 exercises down to like the patient, I'll be like, if you come back and you are like somewhat kind of bored by what I gave you, but you were able to really connect with your breath and you really felt engaged, that means we were doing it right. And they're like, and you're just giving me like one exercise. And I'm like, I don't want to overwhelm you. And they're like, okay. And I'm like, we're going to build on success. I swear, trust me. And it's so funny.
But that's evidence of what we talked about earlier, like building small, attainable goals, and then you can really build mightily. But I'm the same 2-3 max that will do. And sometimes patients do look at you like, I just paid you all this cash, right? What this is, but you're like, no, like, yeah, trust me and trust your body, and then we're gonna.
Totally. And then I have to like, sometimes I found myself talking to a patient the other day and I was like, I'm not going to give you any more exercises. And they're like, okay. And I was like, just so you know, this is my clinical reasoning for why I'm not giving you any more exercises. And they're like, okay, cool, Laura. And I'm like, so I'm not going to give you any more. And they're like, okay. And I'm like, okay, I think I just need to say it one more time for myself. Just so you know, it's worth it. I'm not giving you any more. And they're like, oh, okay. So, yes.
That's great clinical reasoning. I think it helps too when someone is a little bit has higher severity and higher irritability. You don't know what flares them up. So if you give them so many things to do at home, and I would encourage people, anyone on here that's either had PT in the past or seeking in the future, like seek out a PT that really keeps that in mind, like keeps the mind and that regression progression we talked about.
So this is like a slight like random off, but I saw you were into essential oils.
I am.
Oh my God. I have had, so you will be technically the third person who has mentioned essential oils on my takeovers. You're like unofficial third. I had 2 other people who no, 4. You're 4. I love essential oils. So like, how obsessed?
It's funny that my husband Adam calls it witchcraft. I was like, it's natural and we're doing it helps. And then using up thieves is just a blend of like a bunch of antimicrobial, but it's like lemon, cinnamon. I could read it's right beside me if you wanted me to read it, but I'm a big proponent of just using what kind of God has given us on this earth to like help. And it's not to replace medicine, but to complement and promote healthy behaviors. But just smells that can be relaxing, oils that can be healing or help with relieving pain. I use them on the daily and a little bit more since coronavirus.
Yes. So one time I was a tad stressed. This was many months ago, and I was diffusing all of the diffusers in the house, and my boyfriend came home and he was like, did you burn something in the oven? Because it was like it looked like there was smoke in the air, but it was just because every room had a diffuser in it and I had it like full blast. And I was like, it's lavender. And he was like, okay. And I was like, it's lavender coming at you. So yeah, when I saw your diffuser, I was like, yes.
It had some incense going, and I wasn't sure if you were going to see the smoke and be like, what? But that's when Adam will comment, are you burning the house down? And I'm like, no, I'm not burning the house down. But frankincense is like my new favorite, like incense to burn.
Yes. Have you looked up like what are the properties?
Yes, they're like relaxing and healing. So that's specifically why I chose frankincense.
There you go. Okay, I see. Yeah, I always think it's interesting to know if I feel oddly pulled to something to just look and be like, what is that saying about me right now? Or what is it that I need? But for patients, for me, I always do clary sage, which is supposedly like a hormone balancing kind of thing, which is really good for, of course, all of the lovely women's health stuff.
I will look it up. So thieves, I had to look it up because it was bothering me. Clove, lemon,
Yes,
cinnamon bark, eucalyptus, and rosemary.
there you go.
Some of them are peace and calming, but mostly a lot of them are antimicrobial, antifungal.
Yes, I love that. So I have that, and a lot of people ask me, "Oh, okay, so since you treat out of your like home office gym, what do you do?" And I say, "Well, I do like the standard, like go through disinfect stuff." But then I explain like, "Oh, I have a whole like essential oil thing that I'm also diffusing. I have like sage, and I like to like sage and smudge the house." And I was like, "Did you know that there's evidence to say like sage?" And they're like, their eyes kind of gloss over it.
Yeah, I do think, I don't share it with everyone, but I did know that I did my research that some of your viewers would appreciate it. And I noticed that 100%, at least when I checked the poll, said they use essential oils personally. So that was kind of cool.
Yes.
Not something I necessarily broadcast that people aren't close to me. Because like you said, that gloss over, some people
Yes.
can. But, I think it's like any healthy behavior or behavior that is part of your health regimen. I don't care if it's not backed by evidence, if it's something that facilitates like a peace or calm or health.
Yes. And so one of the individuals, Dr. Laura Ritchie, who had done a takeover and happy hour, she was talking about, and actually I'm going to order a lemon essential oil. So she was talking about the benefits of getting that to put in your water versus then having to like buy a bunch of lemons. And I was just like, why didn't I think of that? Because I'll buy a bunch of lemons and then like I don't want to use all of them and then they'll get really, really hard. And then my boyfriend will be like, oh, I'm so glad you used all of these lemons. And then they'll be like, he'll knock them on, and I'll just be like, just don't, BJ. Just don't bring it up. Okay, I'll use the bag next time. Okay, we'll go to Costco. And then I'm like, well, wait, are they organic? And da da da. So she was like, just keep it simple, Laura. Just get essential oil like lemon. And I'm like,
It's
crisis averted.
and lime and water. The lime oil is really nice too.
Oh,
Yeah.
yes.
So
So
good.
awesome. So I wanted to make sure that we highlighted that because I was like, a fellow essential oil person is among us.
It resonates with you. Some of my colleagues tease me, but they all use it. So I think
Does Jeff?
No.
Does Jeff use it?
no. But sometimes I can get Tim Flynn to buy into it. We're on
There we go.
or at least use it. I don't know. You didn't get buy-in. Maybe
Right.
that's all to say.
Right. Buy-in is a light word. So another thing I wanted to highlight and make sure that all of my viewers know about is you have been posting videos like pretty dang regularly on your Instagram, and they have been so, so helpful. Has that been, are you like trying to keep a posting schedule, or is this just something where you found like, okay, this is a great easy space for me to save exercises that I give patients, because I've been really learning quite a lot and I love it. And so I've been sharing them with some people online and I really, really enjoy it. So
Thank you for sharing. I think that my social media space is still a work in progress or ebb and flow and exploratory, and that I try to just use it as a place to share information because I want, health promotion and wellness. I want preventing injury before it starts. So just trying to share exercises that increase resiliency of all body parts. And then often I'm inspired by something that's helped me or something that's helped a client that I've recently done. And I'm like, I should share this. And then it does serve as a library to just send to clients. And I haven't gotten here yet, but like I try to also put them onto YouTube, but I haven't been as successful and consistent with that. I have like 6 to 10 videos there. And that is where that ebb and flow of time, sometimes out. So, all of my business goals aren't always getting met at the moment, if I'm being transparent, just because of the stage I'm in, learning and being in school and teaching. And so, but I appreciate you sharing it and being a part of it. But it is a space that I'm learning too, that maybe I need to just share a little bit more about me. And that I think, like you do, I think you do an awesome job of sharing you. And I think that's what draws people in, not just like an exercise library. And the exercise library that I share, I don't think just a bunch of random exercises help people. And so also letting people know that, this is just free resources, but that if you really are in or have an injury, you should talk to a local PT. It doesn't have to be me. I just want you well. So, let me help you navigate that if you're not sure who to go to.
Right, right. Yeah, I love that, and definitely a plug at Drive PT. And now remind me, do you also have a website? Because we'll make sure to tag all of this,
I
all
do.
of the things. So let me know, where can people find you?
So drivept.co, so .co, not .com. And that's on Instagram, and that is also my website. So it's just drivept.co. It'll come right up when you type that in. And then if you wanted to get to me personally, both I answer, but LT Hughey is my Instagram, and that's also my Twitter, which I'm a little less active on. It's interesting. I hear what you think, Barb, but like Facebook, I feel like I still have a presence there. And it's, again, drivept.co, but it's very minimal. It seems like less people engage there. So I kind of make that more an general information space. Like, here's my book, or here are my hours, or
Yes.
Instagram if you want more, kind of thing.
Yes. Yeah, I think it is really interesting. So full transparency, I get help with all of my stuff. So I have a social media person, Erin. She might be on here. She helps me. She's amazing. And I have Jonna Lynn. She's also amazing and helps me. And I have Stephanie. She edits my videos. So I have an entire team that helps me. So, and they're all over the world. And it is really, really challenging. But I'm just so I love seeing other people's stuff, and I'm trying to get better at sharing more people's content so that the right patients and the right clients can find their way. And maybe when you have time and space, you could do a little post for us on the blog about midline stability and all of that stuff, because I just loved how you highlighted it, and I thought it was so cool how you took away that kind of core stigma, and I just can't wait to like dive in. And I was just like, oh, I can't wait to play, and I would love to have you like back on to do a whole nother thing in like 3 or 6 months on it, because I feel like I'm gonna learn so much myself on this midline stability, and I want to just like kick core out of my vocabulary and add in this instead.
That would be awesome. I think that would be really cool. It's like me and Hey Guys, just got to get.
Yeah. Yeah. Oh my gosh. So y'all is one that I've told, which sometimes does not feel as like normal to me because I'm not from the South. And so it is something that takes time, because I've said it, and then yeah, so you'll get there. You'll get there.
Yeah, I can't do y'all. I can't bring myself to do it.
Yeah, you're like all the way in Delaware. That would be like so. I can't even. I like sometimes forget how like where you are, and then I like look it up on a map just to be like, wait, where is Lindsey and what time zone is she in? And then I like look and I'm like, I just still can't believe that you're all the way over there. For some reason, I think that you're in a state much closer to me. Like, I feel like you're just like 4 hours away. And then I like look to where you are and I'm like, how is she all the way over there?
State that everyone forgets about has become my tagline.
Yes.
One says when they meet me, they're like, I don't know anyone from Delaware. You know?
I know. I want to have you on another like happy hour to be like, how in the world did you find your way to Delaware?
I'm from Maryland originally, actually.
Oh, okay, okay. That makes more sense. But I was like like I said, every time I'm like, wait, where is she? And I like look and I'm like, all the way over there. Well, thank you so much for being a guest, and thank you so much for being doing takeover. And I so appreciate it. And like I said, we would love to have you on again. It was such a pleasure. And yes, I wish you all of the best.
Thank you, Laura. Thanks for being such a beautiful soul and sharing and being willing to share in this space with me.
Yes, definitely. Have a wonderful rest of your night. Tell your family I say hello.
I'll tell PJ I said hi, okay?
Yes, bye.